How is bladder post-void residual volume measured? Have you ever wondered how doctors measure the amount of urine left in the bladder after you go to the bathroom? This measurement is known as post-void residual volume, or PVR. It helps assess how well your bladder is functioning and can identify issues like urinary retention or incomplete bladder emptying. These conditions are important to understand, especially for managing bladder health and conditions such as bladder cancer. There are two main methods used to measure post-void residual volume. The first is ultrasound measurement. After you urinate, a healthcare provider will use an ultrasound device to scan your bladder. This is done non-invasively, meaning it does not involve any instruments being inserted into your body. The ultrasound probe is placed just above your pubic bone, and images of your bladder are captured from different angles. The volume of urine left in your bladder is then calculated using a formula that takes into account the length, width, and height of the bladder. This method is quick, painless, and avoids the risks associated with catheterization. For adults under 65 years old, a normal post-void residual volume is generally less than 50 milliliters. For those over 65, it is less than 100 milliliters. If the volume is above 200 milliliters, it may indicate significant bladder dysfunction. The second method is catheterization. This is a more invasive procedure where a sterile catheter is inserted through the urethra into the bladder right after you urinate. The catheter drains any remaining urine, and the volume is measured directly. While this method is accurate, it does carry some risks, such as infection or discomfort. Catheterization is often used when precise measurements are critical or when ultrasound results are unclear. In clinical practice, ultrasound measurement is typically preferred due to its non-invasive nature and sufficient accuracy for most diagnostic purposes related to bladder health. Catheterization may be reserved for cases where ultrasound is inconclusive or when exact measurements are necessary for treatment decisions. Measuring post-void residual volume is crucial for evaluating symptoms like urinary incontinence, frequent urinary tract infections, or suspected bladder outlet obstruction. Elevated PVR can indicate incomplete bladder emptying, which may lead to infections or complications. This is particularly relevant for those being monitored for bladder cancer. Overall, measuring post-void residual volume is a valuable diagnostic tool in urology. It helps guide treatment plans and monitor bladder function while minimizing discomfort and risk, especially when using ultrasound methods. If you have concerns about your bladder health, it is always best to consult a healthcare professional for personalized advice and care.